Small Group Teaching, SGT. Small Group Learning, SGL. Dr. Jalal Mohsin Adeen, Assistant Professor, DTCD, FCPS, Pulmonology. How will you make better doctor? Learning objectives are: characteristics of small group teaching, how to organize a small group teaching, how to ensure qualities of small group teaching, evaluation of small group teaching. Introduction. A small group teaching session that is well planned provides a systematic approach for both teachers and learners, whether it occurs in the university classroom, hospital, or community clinical setting. Effective small group teaching and learning strategies increase student engagement, retention of knowledge, self-directed learning, communication skills, teamwork ability, and peer discussion. Small group teaching has become increasingly popular within medical and health professions education. 3 characteristics of small group teaching: active participation, face-to-face contact, purposeful activity. 1. Active participation. It means that every participant should pay their maximum attention and efforts throughout the class for learning. 2. Purposeful activities. Objective of the session must be achieved by every student. 3. Face-to-face contact. The participants must be in close contact with each other for effective learning. Number of students. Some suggested right pointing arrow 5 to 8. Other mentioned right pointing arrow 8 to 12. The number in grade 8 institutes throughout the world right pointing arrow 20 to 30 or larger. Advantages of SGT. Better ability to transfer skills from teacher to students are: higher cognitive skills, except recall issues, psychomotor skill, communication skill, attitude. Challenges of SGT. Content coverage, number of students, number of teacher, sitting arrangement, teachers' qualities, cost, students' preparation, organizing SGT, seating arrangement, expectation, ground rule, safety, making the group smaller, structuring group activities. 1. Seating arrangement. 2. Expectation, task of the group. Topic title: Learning objectives. Teachers and student identities. Teachers' tasks, student tasks with working method. Learning aids. Assessment. 3. Ground rules. Equal responsibility to learn. Listen carefully. Right to speak. Don't dominate. Help each others. Treat with respect. 4. Safety. A non-threatening classroom environment must be ensured to facilitate students' contribution. Small group interactions make it possible to take careful note of students' learning behaviors, strengths, and academic making the group smaller. Turn a big group into a smaller group. 4. Better control over group. More interactive. Break task into several subtasks if necessary. Time can be saved. Structuring the SGT, SGL. Students will perform actively. Teachers will do passively. To attain the purpose in relation to time. Structuring discussion. Buzz groups are simply small groups of 3 to 4 students formed to discuss a topic for a short period. These groups may be assigned same or different topic to discuss. Structuring discussion continue. One group member formulates a question relevant to the discussion topic or problem and puts it to another person, for example to the person opposite them. Structuring discussion continue. Crossover groups is an activity that encourages students to mix with students from other groups, and is best conducted as a whole class activity, with the teacher supervising. Each member of every group is assigned a number. That is, each group has a member who is number 1, or who is number 2, etc. Common methods of SGT. 1. Tutorial. 2. Practical, demonstration. 3. Case studies. With patients, bedside teaching, ambulatory care teaching, patients' records, case presentation. 4. Simulation. By actors, paper-based, simulated machineries, mannequin. Mannequin for sample collection. Tutorial. Tutorials are held to clarify the difficult issues of lectures. Teacher helps to find the solution by the students' groups. Practical demonstration. At first teacher explain. Right pointing arrow, then teacher perform and show. Right pointing arrow. Then students perform under close supervision. Right pointing arrow. Finally, teacher asks the students. Bedside or chair side teaching. Including some lay terms would also help eliminate confusion. Teacher select the patients. Right pointing arrow. Students take history, perform physical examination. Right pointing arrow. Students make diagnosis, differential diagnosis, propose investigation and treatment. Right pointing arrow. Teacher give feedback. Teaching by patient's records, usually after contact with patient. Right pointing arrow. Students present history, physical examination findings, diagnosis, investigations and treatment of the patient. Right pointing arrow. Then group discuss on it in presence of a teachers. Simulation by actors. Here the healthy persons play the role of patients. Then the clinical teaching continue. Simulated machineries, mannequin. Nowadays many medical institutes use dummy with or without modern machineries for clinical teaching and practice. Structured tutorial classes. Minutes. 1. Introducing, roll calling. 2. 1 Students will tell the learning objectives. 3. Students will be allowed to raise questions. Teacher will raise questions. If students don't, students will answer the raised questions. At last, teacher will answer if the students fail. 4. Clarification and concluding remarks by tutors. Total 90 plus 10 extra equals 100 minutes. Structured practical teaching. 1. Introducing, roll calling. 2. Theoretical instruction by the teacher. 3. Practical instruction by the teacher. 4. Practice by students in several subgroups. Minutes 5, 15, 10, and the teacher will give corrective feedback to the students' performance in their groups. 5. Assessment randomly 2 students will perform 10-6. Clarification and concluding remarks by tutors 10, 90 plus 10 extra equals 100 minutes. Bedside teaching. 1. Introducing, housekeeping matters. 2. 1 student will take history of a patient. 3. Another student will examine the patient. 4. Another student will tell the findings. Minutes 10, 10, 10, 5. 5 times 4 equals 20. 5. The group will debate on diagnosis and and plan for investigations and treatment. 6. Group will review the diagnosis, investigations and treatment done early by consultants. 7. The group will mention the similarities and dissimilarities among these findings. 8. Clarification and concluding remarks by tutors. 5, 10, 10. Total 80 plus 10 extra equals 90 minutes. Sources. Write the following words in Google search box and find the 4 important texts. Then preserve these for further learning. 1. A Handbook for Medical Teacher, 4th edition. 2. ABC of Learning and Teaching in Medicine, BMJ. 3. Practical Guide for Clinical Educators, 4th edition. 4. Effective Teaching in Higher Education. Nano PDF. Thank you all. Small Group Teaching. Learning Pulmonology.